In today's episode, I talk with Dr. Shami Barathan. She's a GP and the founder of the Mint Clinic. She's got over 22 years' experience in the field, and she's specialized within nutritional and environmental medicine. And she's really set up a very integrative model within Mint Clinic that is very collaborative and really progressive in what she's doing. She's also the host of the Six Hats podcast, in which she dives into stress and the effects of stress on health. And so we talk a lot about that on this episode, where we go into things like burnout, stress, medical anxiety, and how stress affects gut health and gut health overall. So quite a good episode. We cover a lot of different topics. So I hope you guys enjoy it. And of course, before we jump into this episode, this podcast is brought to you by Vital Origin, Australia's best and most ethical animal-based brand, helping you reintroduce nature's original superfoods back into your diet. For all of our listeners, you can get 10% off everything in store by using the code SOURCE10 at checkout. All right, now into our show with Dr. Shami Barathan.
All right, Dr. Shami, welcome to the podcast.
Thank you, Richard. Thank you for having me.
Oh, my pleasure. Very excited to dive into a whole range of topics. You've got, quite a broad background across integrative functional medicine, environmental nutrition medicine, all the things that we'll dive into here. So I thought it'd be great to, go into a bit of your background and how you got into doing what you're doing today.
Awesome. So it actually all starts when I started training as a junior doctor. So I finished 5 years of med school and went into training as a junior doctor. And I still remember till this day doing this really long shift. And I'm talking, this was back in 2000. We were doing 36 hours, often 48 hours over the weekend. And I remember nearly bursting into tears when I had to go walk all the way out to the other side of the hospital for a test. And I was exhausted. And I go, this is not for me. I need to change the way I'm practicing medicine. And so it's just really upon reflection, that just shows the intensity of what doctors go through in terms of training, the exhaustion, and almost you can't even think differently at that point, because all you want to do is just get through it. And you're on this literally roller coaster ride. So I went into GP training, but then unfortunately I also felt disillusioned by GP training back in the UK. And just to give you an idea, so we would see patients every 5 to 6 minutes. And so we would see easy 40, 50 patients a day, but that was just not just seeing patients. It would be then admin queries and then requests for home visits. And again, it's just overwhelming and it's just not sustainable. Hence why I think there was a study done quite recently in Australia. There's over 40% of doctors reach burnout. And then upon
Yeah.
reflection, I get that. At that point, when you're in it, when you're in the training, you just want to get through it. There's actually no time to say, how can we do this differently? So that's how my journey started. And there were so many points in my career that I took time out. 2008, I took time out for about a year, went traveling around the world. I was disillusioned. And then an opportunity came out in Australia. And I thought, right, I'm moving to Australia. I need the sun. I love the sun. And I remember those days going to work in the dark, coming back in the dark for weeks on end in the UK. And then
Yeah.
now I know how important that is. I made the right
I
decision.
share in that. Coming from Canada, I know what
Oh,
it's
yeah.
like. So yeah, just gray and dark. It's difficult.
Absolutely. So came to Australia and I saw a shift. I realized I could spend more time with the patient. I control the number of patients I saw. There was much better work-life balance. However, I was in a bulk billing setting and we could talk about it, but there is a difference towards a private setting versus a bulk billing setting and what you can deliver and meeting expectations. On that journey in 2011, I had some health issues, which I didn't realize were all related to the stress response of moving countries on my own, the high stress around that. But I kept going and I went down the conventional route. I wasn't getting answers. And by chance, a good friend of mine talked about ACNEM, Australian College of Nutrition and Environmental Medicine. That's when I dived in and realized, wow, this should have been taught in med school. And then I found my solutions in health and I realized this has got to be shared to as many patients. And that's how my journey began in 2013.
Yeah, great. What a good journey. And we've talked about it before where it seems that the practitioners that inevitably end up down this path and go into functional integrative medicine or become really passionate about a particular area usually have their own journey and they usually become much better practitioners for it. It's an unfortunate thing that you've got to go through that journey, but I think it helps shape that a little bit so that you can come to an area where, yeah, we can start to do hopefully better things in the medical space. And I think I talk about this often, but there's probably a few things where people maybe are a bit surprised where they hear about how conventional medicine often is done. And of course, we'll have the caveat there that that has a very particular purpose and acute infectious care. We need those types of things. But I think the problem we see nowadays is this growing issue and epidemic really of chronic diseases, and how that model just doesn't really work when you've only got 5, 6 minutes to work with someone who has so many multifactorial issues that you can't really get down to it. And I think that's where that integrative and environmental and nutritional medicine is really, really powerful. And there's potentially a lot of people who have not heard that side before. I think most people are familiar with integrative medicine, but if you could maybe explain a little bit of the difference between, say, conventional, integrative, even functional, and then we also have environmental and nutritional. There's quite a lot there for people.
Yeah, I loved how you made the point about the time, that 6 minutes, and how you distinguish, yes, there's acute medicine. So if there was ever an accident, absolutely want to be in a hospital, want to have that amazing care. But however, a lot what we're seeing now is the chronic disease. So chronic disease is the diabetes, the heart disease, the blood pressure, the obesity, but mental health as well, and chronic pain, inflammatory conditions as well. So there's a whole picture of chronic conditions that make you go to the doctor, to be honest, and they make you go to the doctor quite frequently. In the conventional route, it's because of medication. But however, and you've made a really good point, in 6 minutes, what can you do in 6 minutes? There's no time for education around your condition, but also there's no time to go deeper to look at all the areas that actually affect chronic disease, which include sleep, nutrition, lifestyle, stress management. These are major factors that can have a positive impact on your outcome rather than solely focusing on a drug. So to keep it really simple, when you go to a GP, if it's conventional, they go, right, what is your one symptom that you're allowed to talk about in that 6 minutes? And here's a solution, which is often a drug for that symptom. So what happens when you come to integrative medicine, it is more time, a much more detailed history is taken. There's a lot of prep work, so we can save all that time to dive into your condition. And that means we want to know all your symptoms, because they're actually all interconnected. One speaks to another, one's related to another. And then we use a very holistic approach to find the root cause and treat the root cause and get you well, because your body's actually not designed to be unwell. It's designed to be well. It's fighting to be well, but we need to find the missing pieces of the puzzle to help you get well. And often it's simple strategies that make the biggest impact. And for example, just a shift in your diet of just sugar perhaps, or it could be movement, it could be just a sleep hygiene, it could be key nutrients like magnesium, vitamin D, zinc. It could be, we often just keep it simple, but it's just putting that story together makes such a difference.
Yeah, I find that that's the biggest difference is really it's the framework in which you look at the individual. The holistic perspective is really the big difference. And when you when you look at the body as a whole, it really opens up a wider area to look into, like you're saying, things of nutrition, stress, sleep, all these different factors. Whereas typically you're just not looking into all those things with the conventional model. I think often an easy an easy paradigm to view these things from, and it's an example I use sometimes, is where I think conventional medicine sometimes misses the mark a little bit is we look at things from a pharmaceutical perspective always, and again, there's always a place and a time for those, but the vast majority of things we see, it's not like you have a deficit of statins, right? There's usually some underlying reason as to why something has gone wrong. Let's say, for example, elevated LDL, or issues with your lipids. There's usually something that's underlying, and instead of asking why and going deeper, we sort of try to mask symptoms, which I think is why we're not quite getting the results that we want to get now. And I'm glad that we've got more people like yourself really broadening the approach and thinking about things holistically.
And this is a great time to actually just mention that the system is breaking down. And
Mm.
there's, in terms of finances, in order to support the, not only the number of visits that you can have with a doctor, but the number of doctors that are available who are reaching burnout, who are taking time off work. So it's really, really, I think it's really important to address that we need a new route to help patients, not only for patients to get better, but to prevent the system from collapsing.
Yeah, absolutely. I've actually seen some numbers where, and maybe have to fact check me. I don't know if I get this exactly right, but I'm pretty sure this is what it was. Is the cost to the medical system of obesity and diabetes alone will bankrupt the G7 economies, right? So the seven biggest economies even won't be able to afford the global burden of some of these diseases. So
Wow.
yeah, that's very eye-opening, right? For those of us working in the medical space, of we need a different paradigm. We need to approach things very
Wow.
differently. I think that's where that integrative and functional medicine really shines, is that it does give us that approach, and it really allows us to focus on wellness and prevention, which often we kind of go missed, right? It's a very reactive based model. I think if we can focus on improving and optimizing people's health naturally through, like you said, usually very simple things, it's amazing actually the results that you can get.
Absolutely. And it's so interesting. I was just researching recently, $3.2 billion was spent in Australia in the last 2 years for diabetes management. So
Yeah,
can you imagine like there, how much more you can do with that for
yeah.
society, for our communities, instead of diverting it to something that is actually reversible and preventable as well?
Yeah. 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 If we took a chunk of that and put it towards, say, education about nutrition and providing good food and, exercise programs, it would be amazing. We would get such good results, but it is tricky. And I think that ties into a little bit of something we were talking about before, of this aspect. A lot of people have generalized anxiety around health and medicine and everything. And there's this aspect now of medical anxiety. It's maybe a term not a lot of people have come across before, but I know you're very passionate about it. If you could maybe share your perspectives, what it is, obviously, and then dive into that.
Absolutely. So what has come about over years, or whether it's just, is it the impact of COVID? I'm not sure, but patients are fearful of going to the doctor. And I'm not sure if this has come about from the experience that they've had over years, and whether we've created environments that breed fear. So for example, you're coming in, it's super busy, you're all lined up in a row. There's noise from the news, but the news is actually talking about fear-based stories anyway. And then the receptionists are so busy. They might be, not the most polite at that time because they're under pressure. And then you're sitting and you just suddenly hear your name get called out, and then you're sort of told to come in. And it's just literally a very stressful environment when you think about it. And I've heard so many patients feel actually quite traumatized by the experience. And then it's the whole
Yeah.
system of the waiting game, waiting of what could my results show. And it's literally, when I really think about it, it could be done so differently. Hence why Mint was created. Mint
Yeah.
Clinic in Melbourne, and Collingwood in Melbourne, and with my business partner, Kelly Green. We just had this vision that we can do it differently. And it's looking at the whole patient experience, from the time they book to the time they speak to a receptionist to the kind of experience they have as soon as they come in, because it's really relaxing. And it really comes down to looking at music, art, nature, how it calms the nervous system down. I'm all about educating patients on how stress affects the body. So you're educated from the moment you book. So you can get to watch video. The whole process is meant to create collaboration and education. So when you walk in, it's not sterile, it's not
Mm.
clinical, it's really relaxing. And you're meant to relax in those couple of minutes while you're sitting and waiting. And what was really important for me is, we're living in a very lonely environment. People are striving for connection, and that self regulates us as humans. So I was very keen that, our reception staff connect and smile and engage and calm the patient down before they come and see the doctor. And that was so important, rather than being hidden in front of, like a large desk. So that was really key for me: connection, communication, and creating an environment of calming the nervous system down, so you start to learn how to self-regulate. And once you enter the doctor's uh, the doctor's consulting room, we've actually got a massive round table that we sit around, and we collaborate and we discuss, and we come up with a management plan, rather than the old style patriarchal kind of way of doing medicine. So really passionate about it, because I think if patients can have a better experience, they're more likely to seek help earlier. And it means a lot, actually, not only to the patient, but to the health system. It means a lot to the patient. That means early diagnosis of cancer, for example, prevention of diabetes. So
Mm.
if we can create a safe, inviting place for patients. That means things can happen early and they can take charge of their health much earlier rather than waiting for things to happen.
Yeah, amazing. It sounds like within Mint Clinic and what you've done is really bring back the human experience
Yeah.
back into medicine, which is great because it did become very sterile and very medical, which, a hospital, you understand, but in primary care and in a private clinic and things like that, it's nice to be able to bring back in that human experience. And it is unfortunate. I think there are a lot of people that almost see getting their checkup as somewhat of a burden, right? They're like, oh, I have to go to the doctor. I don't want to do this. I got to sit there. I always end up waiting extra.
Yeah.
They sort of see it as not the best experience, which, as you said, it probably shies people away from doing what they should be doing, which is an annual checkup. And that's where that whole preventative approach will come from. If you're not seeing your doctor, then they're not going to be able to diagnose things early or catch things early. And then, unfortunately, it's too late by the time you get there. So I think the more we can shape the environment to be more of that human experience, it'll be so much better for people. And I'm sure a lot of people have had that experience of a very hierarchical sort of dictator like um, session where it's the doctor or the clinician sort of just talking at you and telling you what to do instead of that collaborative approach. I think that's a really important component that, yeah, you sit at a round table, you discuss goals and figure out how best it's going to work for the person in front of you. And I think that ties in the personalized method with it too, because everyone's going to be very different life experiences. And so if you have that time to sit down with them, you can start to shape something that's going to work a lot better for that individual instead of just a cookie cutter approach for everyone that comes in with XYZ.
Spot on. I'd love to share this story with you, Richard. It's actually a patient that came last year and she was in her probably early 50s. And when she came in, I was the first doctor she saw in a year. And what was scary about this story, when she came in, it was evident she had breast cancer because there was a large lesion in her right breast. And it was probably the worst lesion I've ever seen in my 24 years of in my career. And she was petrified of taking that next step. And so what we did, we created trust and, listened to her fears. And she did eventually see the surgeon. She got the surgery and she had a very positive outcome. And I think the message I really want to put across is that she's incredibly lucky to be alive. And that's what can happen with medical anxiety. We're so fearful of even taking action when action needs to be taken. And that's why things have to change, because it can actually lead to death.
That's such a powerful example. I think if people can take away anything from this, even that right there, it's an amazing example of why it's important to help build trust so that you can move people towards the care that they need. And that's probably even more important today where there is a lot of mistrust because of how things have been handled recently and a lot of disinformation, misinformation. I think it's so much more important now to make sure that you have rapport and that you can build trust with people and that they feel safe and comfortable when working with a clinician such as yourself so that, yeah, you can move them into the types of treatments that they probably will need.
Absolutely. Absolutely.
And where does the stress side tie into it? You've mentioned things like burnout, which it's always kind of funny and ironic to me that often doctors are the ones that go through the most burnout and stress to get there, but yet they're supposed to be the models of health. I always somewhat
Mm.
laugh at that. I understand the need because there's a lot you have to learn and there's a lot you have to do, but I think we're learning more and more about how significant stress is in related to health. So I'd love your perspectives on that.
Yeah, I'd love to answer that question in two parts. You mentioned doctors burnout and you're laughing, I'm laughing. It's really unbelievable. I'm just going to share another story. A GP came to see me last week and she's studying for exams. And I was really shocked how stressed she was and she did not know what to do.
Mm,
So she had gained weight, she was not sleeping, and we just went through the basics. And I walked away from that consult going, there's something wrong in the system. There's something wrong here, that she is giving advice, but she is not taking on that advice. So where has that gone? And I'm going to say it probably is in the training, and
mm,
it's the training which is no emphasis on well-being and nutrition and lifestyle, which we actually need to do ourselves before we can impart that on our patients. So there's
yeah.
a massive disconnect, Richard. I feel really strongly about that because I actually hear patients going, well, if my doctor looks worn out, tired, stressed, and overweight, I'm not really going to listen to them. I'm going to not, I don't believe that they're telling me what to do is actually going to work because there's
Yep.
no faith in that. So I think that's actually a major issue, the lack of knowledge of how do we keep ourselves well? How do we fill our cup up? Because we're always giving, we're givers. So it's really, really important to address that the education has to change. So
Yeah.
the learning is really hasn't happened in med school, and it doesn't happen in GP training. So where does it happen? It takes a lot of self-motivation to do it.
Yeah,
And
absolutely.
so, yeah.
I'm sorry to interject. I'll just add because I'm very passionate about that as well. I do believe in the aspect of practice what you preach. Because for me, if you come from a place of integrity, if you're gonna, prescribe something to a patient or to a client, you should probably have the experience of it as well, and not just, throw things out. So I think it does make a difference. And like we're saying, to build trust and rapport, it helps if you are sort of embodying what you're trying to share with the world.
Absolutely. And moving on to the stress, and it really is such an interesting topic because, just for example, the GP, she knew she was stressed, but she didn't know what to do about it. And what happened? She just displayed all the symptoms that can commonly happen with stress, that we ignore the connection. So the common things are, first of all, it's sleep. You're not sleeping that well. Then exhaustion happens, tiredness. And then you may not be eating well. You won't make the greatest choices. And I often say it's like a stress cycle. So when you're feeling stressed, we go to sugar, we go to caffeine, we go to alcohol, and that keeps us in that spiral of maybe anxiety and depression, and again sleep, and the spiral continues. And then as a result, we're feeling a bit sluggish, so we're not exercising, we're not moving, so the cycle continues. And then the chronic stress emerges. So the impact of chronic stress is over weeks or even years, and that's when we get weight gain, we get anxiety, we get depression, irritable bowel symptoms when it affects the gut, um, even affects thyroid. So we can actually go deeper: thyroid, inflammatory conditions, autoimmune conditions, and even osteoporosis, and even hair loss. So it's really interesting. There's actually a spectrum of diseases. And I think the American Institute of Stress actually did a survey, and 80% of GP consults are related to stress. And I see that. So when
Yeah.
you think about it, you may come in for a cough or cold, but why did you get that cough or cold? Let's look back for the last couple of weeks. Most likely, you're probably not sleeping because maybe perhaps you were stressed, you're not eating well. So you can actually link a lot of conditions to the chronic stress response, which our body's not designed for at all. Yes, we're designed for acute stresses, it protects us, but what's happening in today's world is that we carry it and we're not letting it go.
Yeah, I'm glad you added in that differentiation between acute and chronic stress, because there is also that other side, I think, where people now almost become stressed about thinking about stress. And that can be somewhat of a negative effect in and of itself. But there is that difference of acute versus chronic. And there's even something called eustress, right? So we have that aspect of hormesis where we can adapt and we respond based
Yeah.
on stressors. So, we were evolved and able to deal with these acute stressors. But yeah, I think the world we have now is not like that. It is these chronic stressors. And then that leads to the whole cascade of things, like you said. And it's great. And I love having these talks because it lets people understand that stress is not just a psychological manifestation. I think a lot of people think it's just how I feel. It's just in my head. It doesn't affect me. But I think the research now is very apparent and very clear that it does actually affect you at a physical level quite substantially. As you said, things like osteoporosis, osteopenia, even just things like fatigue and energy and metabolism and sleep and circadian rhythms. All these things get disrupted when we have too much ongoing chronic stress. So, yeah, it's great to highlight that for people, and for people who are dealing with stress or borderline burnout. It's important to know that, yeah, it does have actual very real effects, and we need to do something to mitigate it. And so I guess for the people listening here, what are your go-to strategies and things for managing stress?
Yeah, no, even before we go on to it, I think it's really important just to identify, are you stressed? I think often we've normalized it. We've normalized our way of life. And I've had it so many times. I'm not stressed, just really busy.
Yeah,
And just to give you an example, actually, a patient who's in his 40s, he's a medical practitioner, and he came to see me, and he goes, "No, I'm not stressed at all. I just, my wife just had a baby. I started a new business and I renovated all in 1 year." And by the
yeah,
way, he came to see me because at 40 years, he's got osteoporosis,
yeah,
which is phenomenal. I've not seen it in my career for men, especially.
yeah. I've not
And then
seen with a male. I've definitely seen it in female, but never in men.
Yeah. And then, he's gone down and been investigated, but we never really talked about stress. And it just made me reflect, are we not recognizing we're pushing ourselves so hard? He wasn't sleeping well. He was pushing himself, not having a break in the day. He was waking up to go to the gym, working all day, and then just not having a break. And we've normalized that and we called it busy because we're still getting the rewards, whether it's monetary, whether it's validation that you're doing well, you're serving people, but at the cost of our own health. And it was even just recognizing that, I think it's so important, because I think people, in today's world, we celebrate it, we reward it in terms of, wow, you stayed up late and you did that study, and you're at work, and especially in the corporate life, you work and you're working really late and you delivered, but at what cost? And that cost comes not immediately, maybe months down the line, when you finally reach burnout, or when you're actually told to stop. So I think the problem first lies in just recognition, and then that's when you can actually do something about it, because you need a pain point to change. As you know about behavioral change, you've got to have some kind of motivation, because at the moment, if stress is serving you, you're not going to change. If stress is providing so many rewards, you're not going to change your sleep pattern or the way you eat or the number of coffees you have. It's that recognition as, hold on a sec, it's actually affecting me now and causing some level of pain,
Mhm.
whether it is, I'm so tired of being tired, or I really want to do something about my gut now. I actually want to feel alive. So I see a lot of people just surviving rather than thriving. And that concept of even thriving is quite unfamiliar to them.
Right.
So we're living in a world that we've just really normalized suboptimal health. And so in order for change to happen, it's just making that first step of saying, actually, I don't want to be this way anymore. Actually, what does it feel like to wake up in the morning and have amazing energy, to feel alert, focused, happy, enjoying your job, feeling fulfilled, and at the end of the day, to be able to socialize and do other activities, and having such amazing deep sleep that the cycle starts again. And that is actually quite foreign to many
It is.
people.
It absolutely is. And like you said, I think that's the issue, right? Is twofold. One, we have cultural norms and societal norms which have fostered this, burnout culture, which is very apparent, and it's been around for a long time, unfortunately. And I think hopefully we're moving to the direction of people realizing it now. And then there is the other side of people have completely normalized how they feel today and have completely forgotten how good they're actually supposed to feel or how good they used to feel. And that's where we hear, the colloquial notions of like, oh, I'm just getting older, or oh, it's just whatever, blame it on XYZ, instead of having that awareness and being like, oh, actually, maybe something is going on, maybe it's stress, maybe something's wrong. I'm not supposed to feel this way. I think a lot of people have just now operated at a new norm, and they just accept that instead of realizing, like you said, they can actually feel much, much better.
Yeah, amazing. And the question I get a lot is, oh, it must be menopause. It's menopause. It's okay.
Yeah,
That's why
yeah,
I'm feeling the way I am. So that's a really, really good point. So once you've identified it, and I'm going to give you an example of patients that have experienced burnout in my for my patients. And it's really interesting. I've got a psychologist who's experienced burnout, and she didn't realize she was experiencing burnout. So it just gives you a different perspective, that when you're in it, you may not realize it, even though you've got the knowledge. It takes sometimes someone external to say, what do you think of burnout? It sounds like you've got burnout. We've looked at everything else in terms of fatigue and exhaustion and sleep. At some point, you've got to stop. And so some lives can be so incredibly busy. All I can say at that point is something has to stop. Something, you've got to ask for help. You can't have so many responsibilities in a day. And another example is a patient who's got not only school, he's a teacher, school responsibilities, home responsibilities, not getting good sleep because his dog's 15 years old and wakes up twice in the night. And then he's got renovation, and they're moving countries. So it just gives you an idea how lives can get so crazy. And at what point do you say, hold on a sec, do we need to do that now? And so for him, he was desperate. And I said, something has to give, like, ask for help. So when you need help, ask for it. Who can come into your community and help you? And I think that's a massive issue in today's world. Richard, we're living very lonely lives, thinking that we need to survive this life on our own, when we need a community, we need a village to come together and support you. And I think that's number one. You've got to have a look at your long to-do list and go, what's actually a priority? What can give? What can wait? And who can you ask for help? To help, maybe help with the kids or help with meals, or who can step in. Asking for help is really important, and looking at your list and tidying that up and saying, what exactly is a priority? Do you have to go overseas this year? Do you have to do the renovation? And
Yeah.
just looking at what you're saying yes to, because often it's actually not needed. It really isn't at
Yeah.
all. So we really fill up our lists with, and that's to do with whatever desires or pleasing or wanting to achieve. But we've really got to look at that list seriously. So that's number one. Number two is just looking at all key strategies in the day. For example, just deep breathing. A lot of people shallow breathe and not getting enough oxygen, not triggering that vagus nerve. So deep breathing, so easy to do. And number three, just really prioritizing sleep. If that's the only thing you do, that's like the number one. You've got to prioritize sleep and make a sacred hour before sleep, turning off screens, avoiding blue light. Maybe it's a hot bath, maybe it's downtime, maybe it's meditation, creating something that really calms the nervous system down and aiming for really deep sleep, because that's the easiest to give up and the hardest to take back. So even if we
Yeah.
keep it simple, like breathing, sleep, cutting out that to-do list, you're actually going a long way, really going a long way. And then obviously you can go down, we can talk about nutrition, sugar, caffeine, alcohol, all that comes after. But the first step to do is, do I need to do everything that I'm doing right now?
Yeah.
To be honest.
Yeah. I think there was actually a study that looked at what are the things that trigger the stress response the most. And the acronym is nuts. I won't remember all of it, but I think it's novelty. I can't remember what the U was, and then time was the T in there. And so the distance to achieve whatever task you have is actually a significant stressor. So if your time horizons are very short, you're always going to feel rushed and stressed. And so that's where we need to extend it or just cut things out. Like you said, like, is that really necessary? And I think that it ties into what you were saying before for doctors as well of self-care. And so it's changing the priority structure in your mind of you need to take care of yourself too, because if you don't, then you will end up in burnout or worse, chronic disease, and then that's really going to throw you off, right? So if you think you want to keep achieving things, then try dealing with burnout and chronic disease. That's going to be very difficult to continue on the path that you're on. So yeah, I think it's difficult. It is that behavior modification side, and it's getting people to think about that in a longer way. But I do feel like people are coming around to those types of things, and even like you're saying, sleep being so foundational. And say all the things about Andrew Huberman, but one of the things I really like that he's really pioneered is he's really prioritized people to focus on their sleep, which is great. And I think it's important because I put sleep and stress in a similar bucket, like you were saying about stress being sort of a core component that causes a cascade of downstream negative effects. So if you have too much stress, you end up not sleeping well, you end up overeating and going to sugar, and you don't want to go to the gym. And it's the same, I think, if you're not sleeping well. And so if that is not dialed in, it affects all the other healthy lifestyle habits you're trying to do. And so it's really important to make sure that you do manage those so that you can continue doing all the other healthy habits.
Absolutely. And it's really important to say, just do one shift. That's all you need to do. And then you feel the difference, and then you start making another shift. You're not meant to make so many changes to habits all in one day. But just even sometimes observing, oh, what happens if when I drink coffee, what do I feel? And what happens if I don't drink coffee or cut back? What do I feel? It's really important to observe the impact. For example, another patient realized, oh, I get it now, Shami, when you were saying, when I'm stressed, I realized coffee was making me more stressed and anxious. And here I was trying to avoid stress. And here it was. And then she said, oh, I get it now. Also, when I'm stressed, I need to fuel myself properly. So go to the protein rather than the sugar. So that happens when you start taking responsibility of how you're feeling, and you realize actually you will feel different. So another thing I'd love to say is, yes, you can be successful, you can achieve, and you don't have to reach burnout. There are ways of doing it, and there's systems that you can put in place where you have self-care days, really great sleep, getting your exercise, scheduling your exercise in, eating great amount of protein, meat, animal-based protein. I know we're pro that. I've got to say.
Yep. Yeah, we'll definitely
And
share on that side of things.
yeah, getting your protein in. Um, just simple things that you can actually make it so automated that it keeps your system going, keeps that flow going, that you don't actually have to change a lot. It's just adding another thing into your schedule that it's already happening. So, maybe meal prepping on a Sunday, or knowing that dinners will always have good amount of protein, knowing that an hour before bedtime is the sacred time and you're getting good sleep. So as long as you prioritize a few strategies and it's in your schedule, you're not thinking too much about it. It's not like, gotta think about going to the gym. It's already in your schedule. So that's really important. And before you know it, yes, you can achieve, you can be successful because it's there. It's already, the foundation is laid.
Yeah. Yeah. I think the main things there are, like you said, number one is having the awareness and then putting a plan in place. And I think if people just implement those two things, it usually can help quite a bit. And like you said, not overdoing it. So, choose one or two things and start with that. I think a lot of people go wrong in that they try to do the crash diets and the crash fitness challenges where they just go all in and do as much as they can and they go overboard, but that's not sustainable and it only lasts a couple of weeks and then we repeat that cycle. So I think it's important for people to know if you want long lasting change,
Mm.
then you need to work on small, simple habits over long durations. The crash diets and the crash exercise classes and things, they generally don't work out too well.
I'm so glad you mentioned that, because this is great, because I see a lot of women who overexercise and undereat, and their body's
Yeah.
not ready at all, because that's actually the body reads it as the stress response.
Yeah, that's
And
more of a stressor.
spot on. That means you actually put on weight. And so you've got to break that cycle. You've got to recognize that your body's been in the stress response, and you've got to do everything to calm that down. So it's really interesting when I have this conversation with patients. I don't want you to do cardio. I want you to really just go for long walks, do um, yoga or exercises that really calm the nervous system down. And I want you to eat more. So it's completely the other way around. And guess what? They do lose weight. They feel better. So it's just recognizing it's not the right approach to suddenly go overexercise and undereat.
Yeah. Yeah, it is again, I think another sort of cultural norm.
Mm.
And a lot of it's probably been shaped around that paradigm of calories in, calories out. So
Yes.
it's move more, eat less. That's always the old notion that we've talked about. Well, not we, but in the
Yeah.
medical system and in nutrition, they've always talked about that. But I think when you dive into food quality and how food changes our metabolism and influences the way that our behavior is around food, you start to realize that food quality becomes really important. That's where, like you said, like protein is foundational. And a lot of people, and
Mm.
you maybe see this as well, pretty much everyone I work with, other than maybe say bodybuilders and athletes, but every general population and definitely most females, I've never seen a single one achieving their protein requirement based on the current literature. They're still talking about, zero point 0.8 grams per kilo, which we know is not sufficient for healthy or people who are exercising or even for like healthy body composition.
Mm.
We need to be up in the 1.2, 1.4, 1.6. And
Yeah.
I think when people actually look at what they're supposed to be consuming for their protein servings, they're very surprised at actually how far off they are.
I totally agree with you. And I actually see so many people not even reaching 1 gram per kilo. So that's actually their starting point, and they've got that place to work to 1.5. And when you're ill, you go to 1.8 grams per kilo. So that's number one. Literally 99% of patients are under eating protein. And you've got a good point. It's only the bodybuilders and athletes that are actually eating enough protein. And when you do eat protein, I always say, protein are the building blocks to everything in your body. So all your happy chemicals, your hormones, your enzymes, energy, immunity, gut lining. It's just phenomenal what we need amino acids for. And this is a great time to talk about animal protein versus plant protein as well. Because unfortunately, you're just not going to get enough protein if you're eating just plants. it's just 50% bioavailable. The amino acid taurine, which is so important for our health, mental health, just not available in plants. And I have to say, it's interesting conversations I have with patients when the common reasons why they go more plant-based. One is sustainability. Number two is perhaps religious, but to be honest, most of the time it's sustainability. And to be honest, the other one is the programming around meat is bad for you.
Yeah.
It's going to give you cancer, or it's not good and healthy to eat meat. And so once I address that, it's quite phenomenal the number of people who start adding more protein and animal protein back into the diet because they've just believed what they've heard, that meat is bad. So yeah.
Yeah, there's certainly a big narrative there, and we've obviously had many other guest speakers on the show that have gone down that, and we've talked about it as well. So I'm glad you sharing that. It is interesting, and what I always find really interesting with people is when you look at how they crave certain foods, but yet the narrative that's in society just completely overrides that. There are lots of examples of people who they say they've gone vegetarian, vegan, plant-based for whatever reason, and they're just dying for some meat. And then there are those individuals who, when they do have it, it's like all the lights have been turned on, but even still, it's very difficult for them to move towards something that feels good for their own health, but they struggle with it because, one, there is this narrative across much of society, but there's also somewhat of a vilification of people who move towards things that they feel is better for themselves. And I feel sorry for those people, and it's unfortunate that so many people feel attacked when they try to do something that they ultimately feel
Mm,
makes them feel better. And I wish we would be a bit more open-minded towards different people approaching different sides. Like, even again, if people want to go plant-based, as you said, for ethical or sustainable reasons, I can support that. We can obviously discuss the aspect of
yeah.
regenerative agriculture and maybe how
Yes.
that's better. But yeah, people get stuck in this dogmatic sort of thinking when we do have very good evidence now that we probably should be consuming animal-based proteins, not only for all the essential amino acids, but even things like B12 and iron and zinc and DHA and EPA and choline and glycine and vitamin A and all these things that we know we can only get from animal
Mm.
sources that aren't as bioavailable in plant sources.
Yeah, no, I loved what you mentioned about it's interesting about sustainability because I've got a counter argument to that. So when patients go, "Oh, I don't want to kill any animals," and I always say, anything on your plate is as a result of killing something. Absolutely. So,
Exactly.
of the monocrop culture, you are killing something, and for someone who's hadn't had that concept, it's actually quite confronting. But it's important to be educated that everything on your plate is as a result of killing something.
Yeah. There's no
So
death-free meals.
spot on, spot on. So that sustainability argument is actually not really quite substantiated. And then when
Yeah.
you go meat is bad, I've got so many arguments about, where is that coming from? Often it's just been anecdotal or spoken about in social settings, and maybe they've listened to something on social media, but it's actually not substantiated either. And so when you understand what animal protein is doing for you, and like what you say, you see so many young women with low iron because of their menstrual cycle. And I go, the easiest way and the quickest way is to eat meat. It's eat good animal protein. Why take iron supplements when that can affect you and give you side effects? And the gut
Yeah.
has actually a saturation point of how much it can absorb. Why not eat just meat? And often my patients go, I think I'm just going to eat more meat.
Yeah.
So it's easy, it's safe, and you just feel amazing in terms of energy, mental health, clarity. So yeah, we can go on for
Yeah.
that.
I'm sure we could. The mental health side, especially, and we spoke with Natalie not too long
Mm,
ago on that mental health side, and how
mm,
she's really pioneering, and a lot of people in that space have pioneered that nutritional
mm,
psychology and psychology. So it's massive there. I did want to touch on one thing because I'm glad you said that. In that, if you overconsume iron, the body naturally regulates that, and I think people don't realize that when they're doing sort of super physiological doses of supplemental iron or IV iron, and that hepcidin then gets upregulated and it prevents really the iron from being
mm.
usable. Plus, there's the aspect of high amounts of free iron is highly oxidative. And so I think people often don't get that narrative. They're just told, here, just take this iron, or here, have a IV. but they're not given full informed consent about a lot of the other potential side effects of that long term.
Absolutely. I totally agree with you. And of course, bearing in mind there's reasons for the IV, for example, like if it's completely like some of my patients had less than off the
Yes.
charts iron,
Yeah.
off the
There's
charts.
always a time and a place.
Yeah, always a time and a place when it's needed. But to be honest, if you've got low iron, why take an iron tablet? Eat meat. It's so easy to get your iron
Yep.
up.
Yep. Or beef organ capsules. Shameless plug.
Exactly.
That's great. Yeah, I could definitely go on about those topics for a long time, but I wanted to jump into another area that you focus on quite a bit, and you've mentioned a bit about gut health and the role of
Mhm.
gut health. So there's probably a few things that we could dive into. The area of the gut-brain axis is really important now, or even just consideration of functional GI issues and how you address some of those, because yeah, you do a lot of work in that space too.
Yeah, absolutely. And I think let's just keep it really simple. What we've actually forgotten is the basics. So it's simple as, do you chew well? Are you eating slowly? And how are you eating stress? Because the body's not designed to eat while you're stressed. So what happens during the when you're de-stressed, it's the opposite, it's the vagus nerve of stress. So vagus nerve actually is called rest and digest. So it's a nervous system that actually is directly linked to your gut to help with digestion, because during survival mode, digestion is not a priority. It's designed to just get you out of there. So blood is actually diverted away from the gut. So if you're in chronic stress, it affects stomach acid, digestive enzymes, movement of the gut bacteria and gut lining, every aspect of the gut. So if you're in chronic stress, there is no doubt and going to be a gut impact. You may not see it now, or it might come out in different forms. For example, it could be indigestion, or oh, I don't really digest protein that well, or I'm feeling bloated after meals, where we talk about small intestinal bacterial overgrowth, and the root cause is stress, because undigested food sits in your small bowel. Bacteria from your large bowel migrate up, and it causes so much harm. In fact, affects the absorption of your nutrients, B12 and iron, magnesium. It can cause constipation or diarrhea, but it's that excessive bloating after meals. And often people have lived with it for years, often 15, 20 years, but it's the root cause for then mental health, energy. And as you know, all these nutrients are needed for so many chemical reactions. So we always go back to the gut, and and often it is the root cause is the stress. So it goes back to that whole mind gut connection. And even just recognizing that, so patients just chewing more or eating slowly can make a dramatic impact on your gut, or taking time out for lunch. Like how many do you hear that say, I actually have no time for lunch, I've got literally 2 3 minutes, I am gulping it down.
Yeah,
It's
just
not
as quick
great.
as they can.
Yeah, not great for your digestion. I say if that's really the case, have a protein shake, because there is no point overloading the gut if you've only got 5 minutes. You've got to sit, take time out, not feel distracted, and take in all the senses when you're eating that food, and allows you to chew well, and your gut will love it. And I always say it's meant to be fluid by the time it reaches the stomach. And what's happening today is, well, we're swallowing food, we're just not digesting. So that's something really simple. And of course, then you've got SIBO, which I quickly mentioned, and then leaky gut, when the gut cells of the lining of the gut are not tight. And that's actually so many things, from gluten to the stress response, and that increases the risk of autoimmune food intolerances. And then, of course, you've got irritable bowel symptoms. So it's a whole spectrum. Plus, gut bacteria is connected to so many conditions, including inflammatory conditions, rheumatoid, Parkinson's, mental health. So it's actually coming along quite nicely. I hear a lot of gastroenterologists now speaking about the gut brain axis, and really
Great.
realizing the impact, but also there's a long way to go in terms of looking at gut health to help with your mental health, to help with inflammation.
Yeah, there's so much there, and the gut is so vast and so complicated, and there's so many areas to go. You've mentioned so many good things, SIBO, for example, which a lot of people still aren't familiar with, and I think even there's still some conventionally trained gastros that I think still struggle with that diagnosis. But for people who are dealing with IBS, it's good for them to understand this diagnosis because in the research, it's something in the range of, I think now they say 30 to 50%, but some research has shown up to 70% of people with IBS have underlying SIBO. And so it used to be sort of
Okay.
a diagnosis of exclusion, but now we're seeing that actually there is at least something that may be underlying. But then, as you said, you peel back the layers of the onion even more, and okay, well, what's the root cause of SIBO? And that's where that holistic model helps. Maybe it's stress. Maybe you're not sleeping well. Maybe it's the food you're consuming. And so if you have
Mm,
two reductionist views, then you kind of miss the
mm,
forest for the trees. So it's really important to view those types of things. Yeah, I think a lot of people are coming around to the gut health side of things between leaky gut, which funny enough, I remember in the very early days when the leaky gut research was coming out and people were talking about it, there was so much pushback about that diagnosis of
yeah.
this
Yeah.
hyperpermeability. And now, yeah, it's obviously well established in the literature, but it can affect so many different
Mm.
areas, including that gut-brain axis. That's why now we even have things like psychobiotics, right? So we have probiotics, which we know modulate mood and may help with
Mm,
things like anxiety and depression. So it's phenomenal how much we can
mm.
change just by addressing the gut. This area I love geeking out on a lot.
Yeah. Amazing.
Yeah.
Amazing. And I
And
wonder if it's a good time to mention about the gut-directed hypnosis program, the
yes, thank
app.
you for bringing that up. And that ties into that sort of stress and psychological component of it immensely.
Yeah, so it was actually this the study was done by Simone Peters. So she is a psychologist who is also the founder of a mind gut clinic in Melbourne, but she's also connected to Monash University. So she did the research there, and it's quite phenomenal. The results equivalent to 78 to 80% improvement in symptoms. It's a 6-week gut directed hypnotherapy program on an app. So it's called the Nerva app. And it's been phenomenal for my patients because I go, at the end of the day, yes, I can treat it. I can treat the SIBO, but we still need to get back to the root cause because if that stress is still there, you're going to relapse. And that's what I see a lot,
Yeah.
patients who tried treatments in other places come back. And it's because we haven't actually attacked the root cause, which is the stress. And we need to disconnect the stress response going to the gut. And that's where it's incredibly helpful and just phenomenal, the results.
Yeah, it's great that you bring that up for people. And it is one of the things that's tricky with SIBO is on average, there is quite a lot of relapse for it. I think sometimes it can be 3, 4 times before people finally see meaningful results. And like you said, it's probably because they've not looked at the whole
Mm,
picture and they missed some of those. So yeah, that Nerva hypnotherapy based program is fantastic. I've used it personally, as I've mentioned before. So highly, highly recommend that app.
amazing. Amazing.
Mm. And is there when we look at, I guess, gut-brain axis for people, are there hallmark things that should give them some insight into the fact that maybe this could be an issue for them? Like what are the big things that you would see for people where you would then it would raise the flag, I guess, of thinking maybe we need to look at your gut a little bit more.
Yeah, it could be as simple as bloating after eating, having meals, or bloating when they're stressed because they're not actually digesting their food. So bloating is it's a simple symptom to sort of recognize, but often we've normalized it. It's only until we put it into the forefront to go, actually, do you bloat after meals? And is the bloating worse at the end of the day, better when you wake up? And when we start talking about it, they suddenly actually connect times of stress to increase bloating. Also, the irritable bowel symptoms of going to a meeting and it's quite a stressful meeting. You might be going to the toilet a couple of times, whether it's diarrhea or it's the other way, constipation. And that's when you suddenly tie, is there a stress component? Is there this mind gut component? Obviously, like when you go and see your doctors, they will rule out anything else in terms of pathology, which is really important, in asking about blood in the stools, and that's really important to rule out. However, once you've ruled all the organic causes, we've got to go back to the mind gut connection. And I actually think many people are living with it in simple forms because we've not recognized the connection and we've just normalized it. Oh, that
Yeah.
bit of indigestion or that tiny bit of bloating or the occasional diarrhea or the occasional constipation. And it's only when it's chronic that people start taking action and start making the connection.
Yeah, yeah, it's very true. It kind of comes back to that discussion of people just getting used to a new norm. And so it's
Mm,
progressively gotten worse and they just accept that that's the normal now, forgetting that, maybe 5, 10 years ago they didn't have those issues. And so it should raise the flags a little bit of, yeah,
yeah.
something's maybe not right there.
I'd love to share another patient story where a patient came to me and he normalized going to the toilet 15 times a day. And I'm not kidding.
Wow.
It was at
Wow.
least 4 to 6 times just before work, during work. It was a queue when he went to a different place, even to the supermarkets, dinners. His life just revolved around going to the toilet. And I just sat in shock and awe of how he's managed this for years, but that was his normal. And
Wow.
so it's quite scary what people have normalized.
Absolutely, yeah. And it probably shouldn't go understated as well for those who are listening that maybe have something similar. There are certain pathologies which you do probably want to screen. So things like
Yes.
colitis and inflammatory bowel disease can be one of the things where if you're going that frequently, yeah, that could be an underlying issue. So definitely, don't just think that that's normal. Definitely go have a
Oh,
chat with your doctor and yeah, get it checked
get
out
it
a little
ruled
further.
out.
Yeah, yeah. And
Absolutely.
as you said, screen those major pathologies, and if everything's okay there, then yeah, we need to dive in to
Mm,
those deeper levels.
absolutely. Yeah.
I wanted to tie on one thing as we sort of round it up, because I know you're an avid sort of outdoors person. You like hiking, you add in piano and music and a lot of these things. And you mentioned early on at the beginning the role of community and all of that too. So I'd love your perspective of how all of these things fit into health and medicine, because I'm the same. I think that we need to reincorporate things like community. We used to be in small tribes. We need to spend more time outside, all these things that were natural during our evolution. So how do we bring all of these things, music, all of that into the medical environment?
Absolutely. I love that question actually. And just from a personal point of view, I know what I crave and what I need on a daily basis. So just to give you an idea, I've got a great morning routine, just getting that morning sun. I've got my meditation, and then I have my quite a high protein breakfast, and then I walk to work. And it's great just to clear the mind. And at work, I'm really fortunate. I play some lovely music in the background, which is quite calming and really relaxing. And then we're surrounded by nature and art at work, which is again something that I can just glance, in between patients, just keep that nervous system calm and taking time out. And lunch breaks, have a lovely, good lunch break. So that means I go out, get some sun, do a walk, and then come back, and then I walk back home. And so I've created a life around that, just incorporating it into my daily life and even to my work life. And then when I'm not working, I love my walks by the river. So I'm just fortunate to do that. And then I get regular massages, and then I have a personal trainer. And I've just scheduled all of that in to fill my cup. And then I have time out, and I do infrared saunas and red light therapy, and
Amazing.
I do all of
Got a
that.
good routine, very good routine.
Yeah, and you know what? I realize that's needed. I need it because if I'm going to spend, which I love giving, and I if I that's the nature of my work. I need to make sure I'm well, and if I'm well, I know I'm going to do well for my patients. And you can easily tell when practitioners are not doing well. It's not a great consult because, and you feel that, whenever you've had a consult when the practitioner's not feeling great, you get the energy. So I think
Yeah.
it's really, really important to create all of that balance. But also, it's just that time for self-reflection, to going, is that really needed? Do you really have to do that? What are your goals? Just really question where you're going and what's actually fulfilling and what's needed. And it's taken a while, but I've learned to say no to a lot of
Mm,
things. And I may not go, actually, I'm not going to go out that night, or I'm going to say no to commitments. I'm going to say I don't have to respond to every text immediately. And it's those simple things, because in today's world we get bombarded. At some point you've got to say no. At some point you've got to create those boundaries.
Yeah, but it's funny. It's the paradox of the digital age. It was supposed to give us more freedom, but it's probably
Yes.
entrapped us even more because now we're constantly connected to something, and we don't actually just have that time to be quiet, go for a walk, appreciate some art, listen to some music. And when we talk about stress and the environment that's been created, I feel like that's often a missing piece. We are stuck in that productivity, busy world,
Yes.
and I think people would serve themselves well if they just took some time to think about their environment, how they shape their environment. What are the things that you actually enjoy doing? What do you like doing? And how do you incorporate those things more into your life? And then you'll start to feel better just by having those. But it does take a conscious step to actually shape your life around those things. Otherwise you just be controlled by the things and people around you. And yeah, before you know it, 10 years have gone by and you're like, crap, what am I doing right now?
Absolutely. A few things I forgot to mention. You've mentioned something really important, blue light. So I've downloaded iristech.co on my laptop and telling all patients to do it. Just making sure you get enough nature, getting enough red light, and also water. Water is important, and EMF, just reducing EMF exposure. I think I've just covered a lot there. And it just
Yeah.
seems like a lot. And I always say to patients, it seems like a lot, but it's a journey. And that journey can be a year, it can be 2 years, but you're on that journey and it's exciting, because every time you start reducing your toxic load and increasing the amount of nourishment, your body feels better and better.
Yeah. Yeah. I think that's an important takeaway for people to realize is that time horizon again. So expanding, how long you think it might take in order to feel better, overcome that chronic disease. The old adage is however far you walked into the forest, you've got to walk out. So if you've had 40 years of a lifestyle of, you know, the standard Australian diet and chronic stress and all these things, it's not going to be a
Yes,
couple
not
weeks or a
overnight.
couple months journey. It's going to be potentially a couple years journey.
Absolutely, absolutely. Amazing.
Great. Well, thank you so much, Shami. Any last thoughts or inputs for people listening?
I think anyone who's listening to your podcast, Richard, I think they've already thought about their health, which is so important. And if they haven't, and then they've just found you, I think just sitting back and reflecting, congratulate yourself for taking that first step of educating yourself. And this is a journey and it'll take whatever time it needs. And it's just taking one step at a time.
Yeah, excellent. And how can people find you and your work if they want to reach out to you?
Absolutely. So just to go onto our website, www.mintclinic.com.au. And we actually have a great burnout quiz on there now. So anyone can go on and
I
have a
saw
look.
that.
Excellent. And then you can, there's also a burnout online program, which I'm really excited about. And so a lot of resources. And of course, I'm also a podcaster. So I host the Six Hats podcast, and it's all about spreading that awareness that stress can affect the body. So why wait for something to happen? Why can't we take action now?
Love it. Excellent. Well, I'll put all of those in the show notes for people if they do want to reach out. Otherwise, thank you so much. And I look forward to talking to you again in the future.
Amazing. Excellent. Thank
Thanks,
you.
Jamie.
Thanks for listening to today's episode. If you enjoyed the content, be sure to subscribe so you don't miss out on any future episodes. And if you're looking to add in nature's most nutrient-dense foods back into your diet, be sure to check out vitalorigin.com.au and use coupon SOURCE10 at checkout for an extra 10% off. We'll see you guys on the next episode.